Well, what about the Medicaid? That's what everybody seems to be so up in arms about.
Yeah.
Uh, your thoughts on that? There were a number of Republicans who felt like this is going too.
Yeah, there were three or four, particularly in rural areas, that brought that critique. And I will say I think their concerns are overdone. And here's why. The people that express concerns about Medicaid, first of all, we've dramatically expanded Medicaid in the last 10 years. 40 out of the 50 states, including Virginia, have dramatically expanded Medicaid. Governor McCall did it. It was something that was in the Obamacare bill. It was an opt-in by the states. 40 out of 50 states have done it. That changes the whole nature of Medicare. It was supposed to be for the aged, blind, and disabled. That was the original purpose for Medicaid. Now it's for single adults, and the income levels have crept up. So we've made Medicaid much more than just a healthcare problem. It's now almost a new entitlement welfare program that honestly Bill Clinton and Newt Gingrich reined in, if you will, to back in the 1990s. The second reason I think that these concerns are overblown, and I know it personally because we reformed welfare in 1995 in Virginia. I carried the bill for Governor Allen. And the biggest criticism of the bill was we were requiring accountability. If you're going to get all the benefits for childcare and health care and transportation and food and all these things, the simple requirement was if you're an able-bodied person, you get a job or you go in training and you work for your benefits. To me, as a social compact with people, that's a fair agreement. And that's the concern that people are bringing up now. If that this is going to be terrible, that people have to work for their benefits, they can't find work. And I think that just never happened, Janet, back in 1995 in the state, in 1996 when Bill Clinton reformed welfare nationally. All those concerns proved to be overborne. There were jobs for people to work if they're able-bodied, and if they're not able-bodied, then they don't have to work. They get an exemption. So I don't see that happening. I think these concerns are vastly overstated. All these concerns that what would happen to rural hospitals when we had some other policies just haven't been borne out, and they've gotten a lot more revenues the last 10 years because of Medicaid expansion. So if it proves to be true and rural hospitals start to actually cut services or some actually close, I can virtually guarantee that the Congress will take the appropriate action and they'll make some changes to the Medicaid rules. But these entitlement programs are, in addition to the debt, Social Security, Medicare, and Medicaid are on a trajectory of not being self-sustaining. So we can't just pretend that we have an endless pocketbook of money and that we don't have to have fiscal accountability in these programs. So again, my bottom line is I think the fears are the same ones that were brought up 30 years ago. They didn't actually manifest. I don't see it happening. If they do, Congress will take action.
Yeah. So when they say 11 million people will be thrown off health care, you think that's
I mean, we heard the same thing with the bill that I carried for Governor Allen for welfare reform, that we were going to have all these crises and people not being able to work. I think those estimates have some assumptions in there that don't look realistic to me, and I don't see it happening. But in our political day and age, people bend the truth to make their points, and I don't see estimates that are credible that show 11 million people are going to be thrown off. If they don't qualify because there's more rigid verification requirements, then that's the way the law is.
obviously the Medicaid cuts that's something that has caught your attention. I mean, as a doctor, and not just former governor, how concerned does how concerned do Virginians need to be about that?
Well, I think they need to be very concerned. And again, when we talk about health care, I've always believed that health care is a right. I mean, nobody should have to decide whether they go see a provider or whether they are able to put food on the table or or whatever else. And people are going to get sick. They're going to need to see a provider, and a lot of times no fault of their own. So when we talk about Medicaid expansion, we were able to do that in a bipartisan way, I will add, when I was governor. And again, that allowed over 600,000 individuals to have access to health care. And it was, timing-wise, very, very important with COVID. I mean, I can't imagine individuals during COVID that wouldn't have had access to a provider. But what has happened when we take away health care from individuals, it's inhumane. Again, people are going to need to go see the provider. And so when we take away health care, what that does, it's not fair to the individuals and their families. It also hurts hospitals. And we have rural hospitals in Virginia, good hospitals, but it's difficult to maintain them and stay in a positive, number, even with Medicaid reimbursement. And so if they start talking about cutting Medicaid, and the estimates that I've seen are over 300,000, we see the number 322,000 individuals. Well, that hurts our hospitals. And so if hospitals can't stay afloat, and then if hospitals are struggling, the other couple issues, one is how do you recruit doctors, PAs, nurses, technicians to a hospital or to an area where the hospital may be closing. So that's kind of like a domino effect. And then thirdly, how do you encourage folks to come to rural Virginia? And as I mentioned earlier, people are interested in health care and education. If the hospital system and access to health care is not good, then people aren't want to go to rural Virginia. So that domino effect, it affects the patients, it affects the hospitals, it affects providers, it affects the economy, and in the long run, it drives businesses down, and that hurts our economy. And that is one of the things, Janet, that is so important when we talk about being the best state for business in this country, is to have quality, accessible health care, and I worry significantly about that. And just a couple quick numbers. Mm-hmm. Again, this is not about me, it's not about the hospital, but it's going to affect all of us. I think at the top of that list is our patients. That's who I'm mainly concerned with. But about 55% of our population, our patient population that we see in child neurology is Medicaid. If you look at our inpatient, it's about 65%. So when you talk about cutting, 322,000 individuals from having access to Medicaid, that will significantly affect our hospital.